The broadcast is now starting. All attendees are in listen-only mode.
Welcome, and thank you for joining our webinar, Cenegenics Carolinas Live, Busting the Hormone Myths. On the line, we have Dr. Mickey Barber, Age Management Specialist and CEO, CMO of Cenegenics Carolinas, as well as Tiffany Jackson, Cenegenics Carolinas Nutrition Specialist. We also have three very special Cenegenics Carolinas patients on the line to help explain their journey with hormone replacement therapy and to help answer all of your questions and any hormone myths that we'll discuss. Please stay tuned to ask your questions of Dr. Mickey Barber and Tiffany Jackson after their presentation. All right. Well, good evening, everyone. Welcome to our April webinar. My name is Tiffany Jackson, the nutrition specialist here, and tonight's webinar is Busting the Hormone Myths. So, as you've probably noticed, there are hormone myths that flood the media, and all health books and magazines, they all say stuff different in them, so that leaves pretty much everyone out there confused. So what are the true facts? It's exciting because this evening we have Dr. Barber on the webinar with three special guests to clear up all this confusion. So we do have our guests on hold with us, so we're going to go get started. Welcome, Dr. Barber. Are you there?
I am. Thank you so much, Tiffany. I'm really excited to be hosting this tonight, and really the purpose of this webinar is to shed some light on what is really kind of a confusing area for many men and women and address what I've learned to be some common questions that we get from patients and potential patients. Now, I know some of the listeners probably have their own hormone myths out there, and so we please ask you to submit or ask those questions of us at the end. And we have some great patients on the line who we know that were skeptical about the program before they got started, partly due to all the confusing info out there. And they have been so generous as to give us their time tonight to be our guests. And so thank you to the patients. And thank you to all the listeners. And I'm just going to start by kind of outlining what I found to be a few of the myths that exist out there about hormones. So the first myth is that all hormones are created equal. And the second one is that testosterone causes prostate cancer. The third one is that estrogen causes breast cancer. And the fourth one is that hormones can make me fat.
Well, I know those are a lot of questions that, talking to patients, that they have. Let's clear up the first myth before we start with our patients that we have on hold. All hormones are created equal. I know that's one, patients always have questions about bioidenticals and synthetic hormones. So if you can go ahead and answer that one and get it out of the way, I think that would be a good one to start with.
Yeah. Well, that's really confusing, and no wonder. So let me just try to make it a little less confusing. People talk about natural hormones or bioidentical hormones versus synthetic. The first thing to know is that any hormone that you swallow, put on your skin, or inject has been synthesized at some point. So the synthetic part makes it a little bit confusing. But what we're really talking about is how does this hormone resemble what we have in our body? The problem with the, quote, synthetic, unquote, hormones is that for a pharmaceutical company to sell and market a hormone, it has to be somewhat altered from a naturally occurring substance. And so these alterations that happen now take the hormone that would normally fit directly on the receptors in our body to fit a little less directly. And so when that happens, there are more possibilities of side effects, more possibility that you'll have to use a larger dose of the hormone to achieve an effect. So it changes it a bit from what we refer to as bioidentical or natural hormones, which do come from, in most cases, soy or yam or a plant source, and are the actual identical chemical structures after being synthesized in a form that we can use, identical structure to the hormones that we normally have in our body. Now, let me just throw in a little bias that I have about hormones and why we need to be replacing them. Is some people will say, well, you know, it's a normal, quote unquote, process of aging that our hormones start to decline. And I guess that's true, but if you think about it, is our chemistry and our hormones have really been programmed from an evolutionary standpoint from about 1,000 years ago, and we are really outliving our hormones. Remember, if you look back in history, even 100 years ago, most people were not living to be over the age of, say, 45, and now we're living to be 75, 85, 95, even 105. So we're really being asked to perform without any of that fuel in the fire. So we're not really about kind of letting nature take its course. We want to have you at the optimal level so that we can really, do better, basically, and perform better and be overall healthier. Hope that helps a little bit.
Yeah, no, that sounded really, really good. All right, well, let's move on. I believe Mr. Connie Davis is out there on the phone for our guest patient. Are you there, Mr. Davis?
I am.
Hi.
Wonderful.
Great. Welcome, welcome. I'm so glad you're here tonight, and great to have you participating. And Mr. Davis, can you just tell us a little bit about how you first heard about Cenegenics and our age management medical program?
Yeah, going to my Dr. Scott, my family doctor, he had found out about it and actually went to one of the seminars, and he and I got to talking about it, and he was telling me about the age management and getting healthy and stuff. And man, I was at a point in my life where I couldn't sit up, walk, overweight, just needed I needed some energy. And I went with him. We talked about going, and that's how I found out about it.
Yeah, and you brought him along with you when you came for your evaluation. Now, how old are you, Connie?
I'm 68.
And you're a successful businessman.
I am.
And I know that you were dealing with a pretty low energy level. Do you remember out of 0 to 10, 10 being the Energizer Bunny, do you remember where that energy level was when you came in? Because I do.
Oh Lord, it was down there. It's like 3.
Yeah, I think you were 2 to 3 is what you told me. And
right.
and what is it now after being on the program for a while?
Oh, I'm up there at 10.
Yeah, all right. So you're 68, and when you came in, did you feel like you were 68?
I felt like I was 78.
Yeah, I remember that. Now, did you have some concerns about testosterone causing prostate cancer? Was that something that you had heard about or were concerned about?
I had heard about it. I asked Dr. Scott about it. He assured me that was that was not, that taking testosterone might make the PSAs go up just a tad, but it would not affect and cause it cancer. That was what he told me. So.
Good, good. And so we're going to talk about that in a little bit, but I think that concern, and rightly so, it should be a concern, is shared by a lot of men. Now, so what has been the biggest part of your health that has improved on the program, do you think? And about how long did it take for you to notice?
Well, the testosterone within 3 or 4 days, it's amazing. I couldn't believe it. I called Dr. Scott and told him, I said, this stuff can't work this fast. But it did.
And that was in how your general overall energy, and I think you kind of, you were having some mood issues when you came in to see me, and did that get better too, do you think?
Oh, absolutely.
Yeah, yeah.
Yeah,
well,
that turned around real quick.
Real quick, yeah, yeah. Well, that's great, and don't go too far because we're hopefully going to come back to you with some questions from people that are listening in on the webinar, but thank you for sharing your story, and let me see if I can kind of take that myth about testosterone and prostate cancer and straighten it out a little bit. And it's really interesting because this medical myth actually came because in the 1940s, a scientist won a Nobel Prize for actually taking testosterone and applying it to cancerous cells in the lab and watching those cells grow. And that's really where the whole myth kind of started, which happens in a lot of things. But to really challenge this idea, there have been several studies that have looked at, does indeed testosterone therapy cause prostate cancer? 2 different studies looked at groups of patients. One of them was about 3,800 patients, the other one was about 2,400 patients. And what they did was they looked at it, and these were looking at pooled studies, pulling about 18 to 20 studies together. And they looked at men who were on testosterone therapy and men who weren't, and looked at the incidence, the occurrence of prostate cancer in those 2 groups. And what they found was that there was actually no relationship with the development of prostate cancer in the patients on testosterone therapy. In other words, there was no difference in the occurrence of prostate cancer in those 2 groups. And in fact, even more interesting, what they found in the men who had the lowest testosterone levels, who were in the bottom quartile, which I think Mr. Davis was actually, if they got prostate cancer, it was much more aggressive. So really, really interesting. And so really what we've found is that when testosterone levels are increased to that kind of physiologic range, that is actually where men are the healthiest. So really exciting that, that, again, it was really a medical myth that has been disproved in several very large medical research articles. So now... Go ahead, Tiffany.
Good information, and thank you, Mr. Davis. So next we have Mrs. Hay. Are you there, Ms. Hay? You can unmute yourself.
Hello.
Hi.
Hey,
all right.
Great. Great. Well, Sheila, thank you so much for joining us tonight. Really, really appreciate it. And you have a very special story for a lot of reasons. And I know that you were kind of reluctant to really take a look at the program and were concerned about hormones. So tell me a little bit, did you have some concerns about estrogen and cancer? And tell me about that, because I know you have a personal story with your mom and some other things.
Well, my mother had been put on them for, she had taken them for 20 years, and they, at the time, felt like that, it was heart-healthy decision to do and everything. And then after 20 years on this, and she did do great on that, but they totally reversed it, and it came out that, it was going to cause cancer and all these things, and scared her to death. They took her off of them, and so she basically started to shrivel up. And
and you didn't want that to happen to you, right?
No, well, it was beginning to, and I really didn't know what to do at that point. I had my mood was not good. I didn't feel good. I, was going through the normal changes that happens to you with your mood and the night sweats and everything. So my husband, he found out about you, and a year before me went on the program and just did fabulous. And in the meantime, I went to my gynecologist and tried to go on synthetic hormones, and to no avail. My mood was okay, the night sweats were okay, but I had no libido, and I had no energy. I just didn't feel good at all. And I kept going back, and there was just nothing else she could do. She said she had me on as much as she could do, and it was just not enough.
Right,
So I felt like I was at a standstill.
Right. And I know you were really nervous about needles and concerned that might be part of the program for you.
Well, I don't like needles.
I don't think anybody does, but
well, I have a major fear for needles.
I know, and we're not using any, so that's good, because in most of female patients, we don't have to do that.
And two, even just the blood work, I was just mortified of it. And I feel like, too, that if you had to check yourself constantly, that possibly you were hurting your liver, and things like this. So But my husband talked me into trying it, and I did, and it's just been wonderful.
What do you think is the biggest change in your health and overall that you've noticed and appreciated?
I basically was, before I decided to go on the program, I would lay on the couch and rest for a little bit, and then I could jump up and do a few things around the house, and then I'd have to lay down again. And of course, he said my attitude was not very good. I thought it was good, but he didn't think it was very good.
Darn him.
And I never wanted to have sex. I never wanted to. I didn't have any passion for him. I had just, all that was gone. And so going on it, immediately within 2 weeks, all of a sudden I just felt very passionate, and my attitude changed, and I was just like a different person. I had, and slowly, I felt like I was so far down, down on the bottom of my health that my energy took a little longer than 2 weeks, but I slowly just started doing better and better all the time, and now I swim and I exercise, and I just have a good attitude, and I wished I had found out about it way before I did.
Well, I couldn't put that any better. Couldn't have said it any better. Well, thank you so much for sharing that, Sheila, and for talking about your mom and your own history. And that kind of gives me a good opportunity to talk a little bit about estrogen and breast cancer and uterine cancer. And, it's no wonder that everybody's so confused about it, because it is confusing, and it's confusing for a lot of reasons. But one of the reasons is that a big study came out a few years ago. In fact, it was right when I was starting in age management medicine. I guess it's been about 10 years now. And it was called the WHI, or Women's Health Initiative. And it did a lot of good things, but it was really looking at the synthetic hormones Premarin and Provera, or Prempro, and looking at lots of different things, uterine cancer, breast cancer, heart disease, lots of things. And here's what we know that's true from that study and from other studies, that synthetic estrogen, when used with synthetic progestin, there is a slight increased risk of breast cancer. Now, some of the numbers that came out in the media were very large percentages, but when you actually looked at the actual risk, the number of patients that were getting breast cancer compared to those that were not, they were very small numbers, 1 in 10,000, for example. But that's still something to be concerned about. The other part that came out of the Women's Health Initiative study that was then clarified, because it was presented in kind of an erroneous way, was that there was an increased risk of heart disease in these women. Indeed, that was true. However, the group of patients that they studied were not our typical patients. They were women who had been postmenopausal for 10 years, so they were in their 60s. Many of them smoked. Most of them were sedentary. And all of those things, along with the synthetic estrogens, did put them at a greater risk of heart disease. But that part of the study was never really talked about. So one of the reasons why bioidentical are more safe, again, as I mentioned before, was that they do attach directly to the receptor. Another thing is that, quote-unquote, natural progesterone is different. It acts different in the body, a couple of ways. One way is, well, let me talk about estrogen. Estrogen is what we call a proliferative hormone. In other words, if you put it on some cells, whether they be breast cells or uterine cells, they're going to cause those cells to grow more. That's how estrogen works in our body normally as women. Progesterone is an anti-proliferative hormone. So we always use them together so that progesterone kind of decreases that growth of healthy cells even, so that women don't get a lot of breast enlargement and vaginal bleeding and all those kind of things. Progestin, the synthetic type, is not anti-proliferative. So that actually does worse things when it's added to estrogen, because it causes this proliferation or growth of cells. So I hope that helps a little bit. The other thing is that natural estrogen decreases your risk of blood clotting, whereas the synthetic estrogen increases your risk of blood clotting. So that's all stuff that a doctor needs to know and that patients need to understand, but it is a little bit confusing because a lot of that information has not been out there. And when you look at the studies, particularly in the European literature, bioidentical progesterone and bioidentical estrogens have not been shown to increase the risk of breast cancer and may actually decrease the risk, and the same with uterine cancer. So it's really some pretty exciting things. The other great thing about the bioidentical is that we're able to use a much smaller amount and to titrate or to dial in that amount that we need based on the patient's symptoms and on the blood testing that we do periodically while patients are on therapy. And we also, our patients are up moving, they're exercising, and they're eating right, and they're taking vitamins, and they're taking fish oil to offset any of the potential negatives that we could possibly see. So I hope that helps to clarify it a little bit, and of course, I'll be available to answer questions when we come down the home stretch. So we have Mr. Rory McFarland out there. So Mr. McFarland, can you unmute yourself?
Are you there, Mr. McFarland?
Oh, there he is. Yay, good.
Yes,
Hi, how are you?
Good, great. I'm good, thank you. Nice to talk to you.
Thank you so very much for joining us on the webinar. Really appreciate it, and I know that you're not my patient, you're Dr. Miles' patient, but he has shared with me that you had some concerns about cancer risk before you actually got on the Cenegenics program, and then you did your due diligence and really investigated. So maybe you can fill us in a little bit about your own history and about what you found out while you were doing that investigation.
Yes, I had Hodgkin's disease in 1997, so I was concerned primarily about human growth hormone and if it would potentially exacerbate a recurrence, and we decided that I would not take human growth hormone. I am taking testosterone and DHEA, and it's having profound effects that help me reduce my triglycerides. I believe that it is essential for long-term heart health. My weight is down a lot, 40 pounds or so, and my energy level, my exercise level, my sexual level is up tremendously. So I feel much better, and I, feel the way that I did as a young adult of 30s, perhaps. And I used to bicycle 100 miles when I was 18 to 20. Well, now I bicycle 60 miles and take 2 days to recover naturally. I ski hard, I swim hard, I do a lot of the activities I used to do, but I give myself more time to recover, and I think I can do those things because of the hormone therapy.
Now, how old are you, Mr. McFarland?
I'll be 60 in a couple of weeks.
Great, great. So, I mean, I guess you felt 60 when you came in, huh? Or older?
Well, I like to climb Colorado's 14ers, and I was declining the invitations. And last year I was climbing them again, and I feel great, and I certainly don't feel 60.
Great, great, yeah. And you know what, that's really what it's about, is being able to do things that you want to be able to participate in. I mean, I think that's really important, as well as, getting your health back, and certainly being overweight is not a healthy way, whether you've had cancer or not have had cancer. And I'm glad you brought up that about the growth hormone, because I do find a lot of people think that that's what we're all about. And you're proof positive that that's not necessarily true, and in fact it's really less than 18 to 20% of our patients that are on growth hormone, and it's only when we find it to be medically necessary, and then of course it's a decision between doctor and patient whether that would even be appropriate. So did your growth hormone levels improve? Have they gotten better on the program?
Yes, they have. Actually, Dr. Miles says that they're in the normal range just from increased exercise.
Yeah, Yeah, that's great. And we do see that a lot. Once we get exercising more and building more muscle mass and being more active and sleeping better, that in both men and women, that growth hormone levels can come up anywhere from 15, 20, 25% just on their own. So, and we'd rather have that. It's much better if you're doing that on your own rather than having to use a medication to do that. So, well, congratulations on your success so far, and I'm sure that'll just get better and better. And yeah, and thank you for being on the call with us tonight. And kind of leads me into talking a little bit about hormones causing weight gain, because I think that that's one of the myths that I've heard patients mention before, particularly women. And here's the thing, is that the concept really is that it's important to get the balance of the hormones in order to maintain the appropriate metabolic weight and the appropriate body composition. And as men and women progress through the aging process, and in women that's perimenopause or menopause, and in men that's andropause, what starts to happen is that in women we lose estrogen, we lose testosterone, we lose DHEA, and as a result of that we also see our thyroid function starts to slow down. That changes how we process carbohydrates, the food that we're eating. That changes our metabolic rate. As I think everyone on the call said here, that affects your energy level. That means you're not exercising as much. And what happens is you start to lose muscle mass and gain body fat. And we see this in women, and we absolutely see it in men, because similar things happening in men, except their testosterone's going down and their estrogen's going up. And estrogen in men causes that accumulation of body fat, particularly around the midsection in men, causes loss of muscle mass, and of course affects everything from sex drive to energy to focus and concentration. And what happens is, if you're not feeling as good, your energy's low, you're not sleeping as well, the first thing we do is reach for the wrong kind of food. And so it's really a vicious cycle, all those things playing in together, and rather than being a nice symphonic tune, everything's kind of going in different directions, and what happens is that our body composition starts to change. So that medical myth I'd like to bust right now, that if you really approach the hormonal management appropriately with all the other pieces, that you can actually see an improvement in body composition, which is, of course, the healthier thing to say. So I just kind of wanted to list again what are the 4 myths that we decided to focus on today, but I invite you to throw in some other ones if you'd like. The first one being, or the last one, I guess, that hormones will make you fat. The other being all hormones are created equal. The third being estrogen causes breast cancer, and the fourth being that testosterone causes prostate cancer. So, Tiffany, how do you think that went?
That was wonderful. Oh, and thank you to all of our guest patients. That I know you're taking time out of your evening here. It just really means a lot. I think your stories and testimonials, may end up helping some other listeners out there. So we really appreciate your time, and thank you, Dr. Barber. That was wonderful explanations and details, so informative. And I know there are, a lot of women and men, as they approach midlife, just wonder whether or not hormone therapy is the right option for them. And with natural bioidentical hormones, we know here at Cenegenics that all of our patients can find relief of their symptoms, especially with hormone balance, without the risks of being on the synthetic hormones. So, we just want to remind you, we're here to help you regain your hormone balance, to customize a program for you to help you eat right, exercise, and maintain a healthy lifestyle. So we encourage you to call our office if you have any questions. We'll be here tomorrow, or feel free to send us an email, and I believe we are ready for questions. So I'll let Lindsay take over and answer any questions that you guys might have.
Thank you. Dr. Barber and Tiffany will now be accepting questions from the audience. If you would like to ask a question, please use the chat feature located on the meeting dashboard, or by raising your hand, also located on the meeting dashboard. If you choose to raise your hand, your line will be unmuted, and you will be able to ask your question live. So we already have a couple throughout the presentation. The first question is, what if you already have prostate cancer?
Good question. Good question. We have several male patients at Cenegenics Carolinas and throughout Cenegenics in the country that have had a history of prostate cancer. There have been several articles that have come out in the last, I would say, 5 to 10 years in the urologic literature that supports that in some men who have a history of prostate cancer and have had a prostatectomy, that a year after prostatectomy, if the PSA is below a certain level, that they may indeed be candidates for testosterone therapy. We also have a protocol for men who have had radiation for prostate cancer, that if they are 2 years out and a PSA below a certain level, that they can be a candidate as well. Of course, we're going to follow their PSA, while they're on therapy, but the risk really are much less than the benefits in those men because the risk then after prostatectomy and radiation of developing obesity, diabetes, heart disease, osteoporosis, depression are very, very high. So, we're happy to talk to patients individually or on this call about that. Good question.
Okay, great. The next question that we have is, what is your opinion of HRT, hormone replacement therapy, for postmenopausal women?
Well, it depends on when we would be starting that, and it depends on the woman. For example, if I have a woman who is, say, 72 and has not been on any hormone therapy and has a uterus intact and is a smoker and sedentary, my answer would probably be no. If I had a woman who is 62, let's say, and is 4 or 5, 6 years postmenopausal and is in reasonably good health and has no other big risk factors, then I think that would be fine. And we really treat every patient individually on that issue, looking at risk factors. For example, if you have a very strong history of heart disease in your family, in my opinion, for a lot of women, it's much better to be on hormone replacement therapy along with omega-3 fatty acids and a good diet and exercise plan for heart health versus not treating them with HRT.
Okay, thank you. The next question that we have is there any correlation between depression and low testosterone?
Oh, gosh, yes, yes, yes. Yes, and depression and DHEA, both of those, yes, absolutely. And I bet you that some of the patients on the call could comment on that too, and I'd like to open a couple of their lines up in a minute after we get through a couple more questions, but absolutely.
Okay. The next question is, what frequency do you suggest for testosterone injections?
We typically inject once or twice a week. The typical is once a week because the half-life is about a week. Sometimes we will go to twice a week at smaller doses, but more typical is once a week. This is in men, I'm guessing we're talking about.
Okay. And the last question, Tiffany is going to some androgen commercials warn of getting an enlarged prostate and prostate cancer. What are your comments on that the commercials warn that this can be a possibility?
Mm-hmm. Good question. And that is, I'm guessing, I haven't seen that commercial, but I'm guessing that is talking about a topically applied testosterone. And the thing is, with topically applied testosterone in men, men have an enzyme in their hair follicle that converts testosterone to dihydrotestosterone, or DHT, and that DHT can cause prostate enlargement. It does not cause cancer per se. However, there's a kind of a subset of prostate cancer that does tend to have some relationship with an imbalance in that DHT and testosterone. We find that the injectable form of testosterone does not cause that same problem, and that is why we do not use a topical form. I also think that probably on the commercials, really as kind of to cover themselves legally, that they put that out there as well. As you know, when they go through drug possible side effects on television. The list is very, 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 very lengthy. But the prostate enlargement is seen definitely more often in the topical form.
All right, next question. Is there any way to avoid hair growth while taking androgel?
Hair growth. I'm not sure if that person would like to ask that question. Again, that would help. I'm wondering if you're talking hair growth where you're applying that androgel, or hair growth.
Yeah, I'm not exactly sure. We'll have that person, if you'd like to call our office in the morning, maybe we can get more of a, or it's hair on the chest.
Hair on the chest. Oh, well, I can't speak to that too well because I don't use any topical, and to me it doesn't make sense to use topical in men when we know it doesn't work as well, particularly because of the hair follicles, and men tend to have a lot of hair, and then in some men the topical can cause more hair. So that would be my comment. That's one of the reasons really to not use a topical application in men.
Okay. And we actually have a follow-up from one of the other questions, the person that asked, what is your opinion of HRT for postmenopausal women? She came back and said, I'm 66, I'm in good physical condition and have used HRT for 25 plus years. My primary physician does not want to let me continue as the jury is still out. I would like to continue. What is your take?
Oh, well, I'm with you. I mean, I'm going to be 56 on Monday. 57, and I've been on HRT now for, 13 years probably. Again, I think when you look at risk benefit, look at every patient individually. Unless you have a compelling reason to get off of it, I personally think you should continue it. That's my opinion.
Okay. Next question is, oh, go ahead.
Go ahead. No, go ahead. Go ahead. I just wanted to give the patients an opportunity at some point to question or comment if they have any. But go ahead. You have another question?
Yeah, we have a couple more. The next one is, what are the most common symptoms for a 10-year postmenopausal woman without a history, without a hormone or HRT?
Symptoms. Well, sometimes there are no symptoms. I mean, sometimes, the things that we might uncover during the evaluation that would cause concern, you might not be aware of. For example, there could be bone loss. There could be what's called sarcopenia, which is not enough muscle mass for your body type, so a loss of muscle mass, a gain in body fat. We do a cognitive assessment that looks at memory and recall, so we can pick up some memory issues that you might not be aware of. But typically women are aware of some things like, just kind of feeling a little more frail, maybe not feeling as energetic as they did 15 or 20 years ago, perhaps looking at their skin and feeling like it's just looking more papery, thinner, more wrinkly, not as much sheen, and just not as healthy and as youthful as it once looked. Memory and focus, feeling like you're a little foggy compared to a few years ago. Perhaps not seeing the same kind of benefit from exercise that you had before. And I'll tell you another thing is estrogen is really important for liver metabolism of cholesterol. So as women lose estrogen during perimenopause and menopause in particular, that's when we see that estrogen start to rise, and that's one of the reasons why women tend to have an increased risk of heart disease after menopause. So might not feel everything, but we certainly can uncover some of those things during the evaluation.
Okay. Next question is, how much of a role does DHEA use play?
How much role does DHEA, use play? Wow. Yeah. I'll tell you what, I have been doing this, like I said, for 10 years now, and it's only been, I would say, in the last 2 years that I have really appreciated the importance of DHEA. And that's for several reasons. One of them is that I've been given a couple lectures over the last couple of years that have allowed me to really get into the literature about it. And hearing back from my patients. I have one patient who's in his 70s who's been on the program with me for about 5 years now, And he was very reluctant to get on DHEA when we first started. He had read something in some medical report from the Mayo Clinic that it didn't do any good. And anyway, so he was having some issues with some libido after being on the testosterone for several years. And I said, doggone it, I really want you to try this DHEA. And it really made such an impact on him. Looking at the literature, it is very important for mood. It is a precursor for about 10 or 11 other hormones, particularly the androgen or male-like hormones in men and women. So my personal opinion is it's undervalued as a hormone, and it's very important to monitor your levels and to use prescription quality, prescription strength DHEA, not what you're going to buy at CVS or Walmart or whatever, but something that is compounded and is a prescription strength.
Okay. The last question that we have here from the audience is it safe to take a daily dose of DHEA, 25 milligrams, twice daily?
Well, yes and no. Again, when I first started my practice, I had a woman who came in to see me who was supposedly taking 25 milligrams of DHEA. She was getting it at, I don't know, Walmart or whatever, and her hair was falling out. Now, DHEA is a pretty small dose, really. I mean, we use in women 10, 25, 35, occasionally 50. And in men, we use 50, 75, 100, 125, 150. Anyway, when we got her level back, it was sky high. It was about 1,100, which is, I've never seen that high on any of my patients. So whatever she was taking was not really what that said on the label. So I think as much underappreciated as DHEA as a therapeutic agent, as much it should be valued and used very safely and monitored. So 25 twice a day, I'd have to know what the levels are. I'd have to know the quality of the DHEA to be able to really say yes or no whether that was a safe dose. It's unusual that we use it twice a day, frankly, but sometimes we do.
All right. Well, we've had a couple more questions popped up, but I'm sorry that we are out of time. So we will be answering your questions via email tomorrow at some time if we weren't able to get to your question today. And then I did want to give our guest patients on, I guess we'll go through one by one. Mr. Davis, if you're there and want to unmute yourself, if you have any last comments or if you would like to answer any of the questions that we just had, feel free to do so. If not, that's okay as well. Are you there?
I am.
Okay. Did you want to say anything here at the end?
Yeah, I just want to reiterate what the testosterone and the stuff has done for me about getting back to exercising. And before I started, I wasn't doing anything. And I just got back, I don't know, 3-4 weeks ago or 5 weeks ago, I guess, from out west skiing. And we were out there 10 days, and I skied 7 out of the 10 days, 4 hours a day.
Oh, wow.
So what does that tell you about energy level?
Yeah, great, great.
And just exercising, I'm up to 4 miles a day. I'm not running the whole 4 miles, but I'm running part of it, running, walking fast, but I'm getting close.
Wow.
That's a long way from where I was at.
That is true. Wow. Well, great. Great. Thank you so much.
All right. Thank you. And Ms. Hay, if you're there, if you would like to come back on the call, if you had any last comments or if you wanted to answer any of the questions.
I just wanted to say thank you to Dr. Barber, and I'm so thankful that you know, that I came on board with your program, and that I just have a passion for love and for life now. So thanks again, and anybody out there needs to run, not walk, to get to it.
Oh, you're so sweet. Thank you. Thank you so much.
Thank you. Bye-bye.
All right, and Mr. McFarland, we have unmuted you, so if you have any last-minute comments that you'd like to make, go right ahead.
Yes. Oops, that's a little loud. I would say that, you know, the untold story of the hormones is how much they change your life and kind of give you back parts of your life that you didn't have before. In my case, I'm in love with a 26-year-old girl who loves to climb 14,000-foot peaks with me, and we have a wonderful sex life, partially due to testosterone and DHEA. So, you know, I hope that we're going to get married later on, and I certainly wouldn't be saying that without these hormones.
Great, great. Well, thank you so much. Tiffany, you want to, or Lindsay, finish up for us? And again, I can't thank the three patients so much for sharing what is really intimate information and personal, and we really appreciate it. And we just, I mean, it brings tears to my eyes to hear the story, so it means a lot to me personally.
All right. Well, thanks again, everyone. For more information or if you have any questions, please feel free to contact Dr. Mickey Barber directly or Tiffany at 843-724-7272 or email her at mbarber@cenegenics-carolinas.com. You can also register online for more information at www.cenegenicscarolinas.com. Cenegenics Carolinas is open Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. And again, please feel free to call us tomorrow and so we can answer any questions at 843-724-7272 or register online at www.cenegenicscarolinas.com. Thank you so much and have a great evening.